Is nine.
Go ahead.
It's 9:02. I'm Liz Farrar Campbell, and I will call this meeting of the Early Learning Council to order. Gabby, can you call the roll, please?
Sorry, I was muted. Yes, so Chair Campbell is here. Katie Brooks is running. There she is. Peter Buckley,
Here.
Robin Hill Dunbar.
Here.
Eric Hunter will be joining at around 9:30. Dr. Peg Miller,
Here.
Subin O,
Here.
Ruby Ramirez,
Here.
and Marie Simons.
Here.
Perfect. We have everyone here and we have a quorum.
Wonderful. Moving right along, any public comment today?
There was no request to give a verbal public comment at today's meeting received, and there was also no written public comment received for council today.
Great. Okay, we'll move right into administrative rulemaking. Council, we have a whole passel of rules to take up today. So I think we'll turn it over to Abby, who's going to talk to us about certified family child care home rule set.
Yes. Okay. Excuse me. Thank you. Yes, and good morning. Chair Freer Campbell and fellow council members. My name is Abby Strom, and I am an operations and policy analyst with the Child Care Licensing Division. And today we will be presenting the final proposed rules for adoption related to certified family child care homes. We will give a brief review of the background and rationale for these changes, also discuss the RAC and other public feedback we received, and then the agency's response to that public input. Slide. So just a little bit on the background and the purpose. In July of 2025, we came to the Early Learning Council and presented temporary rules for adoption that were to address key rule omissions from the recently adopted certified family rules. And these rules were related to the prohibition of illegal controlled substances on the child care premises, as well as a general rule protecting children from water hazards. We needed to adopt these temporary rules to ensure child health and safety and also to remain in compliance with CCDF requirements. And as those rules were temporary, DELC had 180 days to adopt permanent rules, or those rules will expire. Those proposed permanent rules will be included in the adoption of these rules today. We are also proposing other clarifications and corrections that have been identified either by field staff or by childcare providers. In October of 2025, we presented on those additional amendments, so those additional corrections and clarifications. And all these rules are projected to not have any fiscal or equity impacts for childcare providers, as they were either effective prior to the recent whole rule set, or only provide a clarification or correction. So again, there are no fiscal or equity impacts were identified either by the agency nor through our public engagement. Okay, next slide. So since October, we have held a rulemaking advisory committee, a public hearing, and then also a public comment period. We had a robust RAC with representation from multiple parts of the state, including Southern and Eastern Oregon. Participants included certified family providers, families, and representative from the child care resource and referral agencies. And we would just like to thank those who participated in the RAC and contributed to the rules. Next slide. So in addition to feedback we received at the RAC, we also received one piece of written public comment. And we reviewed all the feedback and did make some changes based on public input. First, we received feedback on the rule regarding rest time requirements, which can be found in the program schedule and activities section. There were three main points of concern. One was that the requirement to have a scheduled rest period conflicts with rules regarding infant sleep patterns. We do have a rule that says that infants are allowed to form their own patterns of being awake and asleep, and that the way the rule was written required that all children under the age of preschool be on this schedule. So the next piece of feedback we received is that not all of the approved sleep equipment was listed within rule. The rule requires that children be given a sleep surface, and we only included 2 of the approved sleep surfaces. And the feedback we received is just that that rule should reflect that there are multiple options for sleep surfaces for young children. And then the third piece of feedback regarding this rule was that there was a part of the rule required that or suggested that children who do not sleep be offered alternative quiet activities, and that these activities may be offered in another space. The feedback was really around that the other space may cause supervision concerns, or that it didn't really reflect the environment of a family home and is more suited to a center environment where there are multiple classrooms. So as a result of that public feedback, we did modify the rule language to identify that this rule is really for preschool and toddler age children. So it's no longer in conflict with infant requirements. And then we all listed all the approved sleep equipment. And we also removed language regarding the alternative quiet activities being in a separate room, but kept the requirement that they must be offered an alternative quiet activity. The next rule where we received feedback was related to food-related choking hazards. The feedback we received is that some of the rules that were listed can be, as a choking hazard, can be safe for young children to consume if they are properly prepared. So that includes like cooking or shredding or mashing, and that the rule really needed to reflect this nuance. So in response, we amended the rule language to include a list of prohibited foods such as gel candy, marshmallows, or popcorn, which are commonly associated with young children's choking. And then we did have a list of foods that can be served to young children when prepared in a manner that prevents choking. So such as vegetables or grapes or cherry tomatoes, which can all be prepared in a way to avoid choking. Next slide. So, and all of these rules, of course, can be found in, and the changes can be found in the packet today. With adoption today, the rules will take effect on January 1, 2026, which does put us within the 180-day deadline for the temporary rules. And CCLD will begin to update any resources, forms, or templates as necessary with these rule changes. And then we will also be informing providers through both a postal mailing and an email as well. So if there are any questions, happy to take them.
Any questions for Abby, Council? Does not look like it. Okay. Can I get a motion to approve the rule set? Robin, can you take that one?
Sure. I move to adopt the proposed permanent rule language amendments dated December 10th of 2025 that adopt amendments to Oregon's administrative rules as listed on the council's action request for the Certified Family Childcare Home Rule Set Amendments.
I'll second that.
Thank you, Peter.
It's been moved and seconded. Gabby, can you call the roll?
Chair Campbell,
Aye.
Peter Buckley,
Yes.
Katie Brooks.
Yes.
Give me one sec, sorry. Robin Hill Dunbar.
Yes.
I know Eric is still not here. Dr. Peg Miller.
Yes.
Subin O.
Yes.
Ruby Ramirez.
Yes.
And Marie Simons.
Yes.
Great. The motion passes. The rules are adopted. Thank you, Abby.
Thank you.
All right, we'll move on to the next set, which is the early childhood workforce registration, and turn it over to Sydney.
Good morning. I am Sierra Hake, and I'm going to start this and then pass it to Sydney. We are talking about the Early Childhood Education Workforce Registry rule set this morning. Next slide. The process was instructed by House Bill 2991, which aims to improve access to jobs in Oregon's early childhood workforce by addressing the following 4 barriers: the cost of translation, unclear and inconsistent qualification evaluation, the inability to transfer professional development from outside the state, including internationally, and the inability of employers to access registry records. Next slide. For her engagement, we've done quite a bit since 2023, even before House Bill 2991. There was the study, subsequent report submitted by the National Workforce Registry Alliance. 2024, the Early Childhood Equity Collaborative informed the directions of the rules by engaging a large and diverse group of participants through collective interviews, listening sessions, both in person and virtual, and reviewed more than 120 documents. The Oregon Center for Career Development facilitated listening sessions on barriers within the system. And then in 2025, the Oregon Center for Career Development submitted a proposal for a revised registry system. We had meetings on rules internal to DELC with multiple offices then we had meetings on rules external to DELC with the Department of Justice and the Early Childhood Equity Collaborative. We had additional meetings in response to the registry revisions, and then we had feedback in response to a Dear Tribal letter. Next slide. The timeline, the bill requires that DELC could begin the adoption of the rules December 31st, 2025. So this is a shortened timeline of what we've done just in the last few months. Being in September, we presented to the ELC, we did RAC recruitment. October is actually the presentation to ELC. We had our RAC October 16th and 17th, so over 2 days, 2 hours at each of those. October 27th was the public hearing. Public comment period was the month of October. And now we're here at the ELC vote for proposed adoption for effective date of January 1st, 2026. And I do apologize for talking so quickly. I just know that when we get to Sydney's part, she has a lot more to talk about. So I want to make sure there's time for that. Next slide. This is our list of RAC participants. We had a really diverse group that represented tribal members, community-based advocacy, philanthropic organizations, early childhood educators and employers or owners, state or county agencies, and so on. So it was a large, really diverse group, and it was a really interesting RAC with a lot of engagement. And you will see the engagement based on the feedback slides that we have in just a bit. So next slide. And this is where I will hand it over to Sydney Train.
Hi, everybody. Ooh, no, wait, we're in the same room, so I have to wait for Sierra to mute. So these are the rules that we came out with. We have a purpose section that defines the purpose of the registry in these rules. We have definitions, and then we have some administration specific things that really applied to all of the rules below. And I'm going to start out talking about career pathways because that's kind of the largest bucket, the revision of the career lattice. And then we had foreign language translation, ensuring that folks have access to translation, language translation of documents related to the registry. out-of-state professional development, and training and record access. So applying rules to each of those things that Sierra talked about. The next slide. So on the purpose, I believe you have access to these slides, so I'm not going to read through all of these because we'd be here for a very long time. As Sierra said, we had a very engaged group, and so we had a lot of feedback to include. But in these slides, I've put what the change was and whether it was added or not, and what that feedback was. And we actually were able to include everything except some of the comments that were really more related to implementation. And we'll be taking those ideas into our group that's working on the implementation as well. So it was a really thoughtful group and really helpful to our process. So there was conversation about reducing system duplication, making sure there were diverse pathways, and identifying and mitigating inequities. On the next one. In the definitions, we also had a lot of conversation. We've added, talked about apprenticeships being fully approved, added a definition from of CTE from the ODE CTE department, the Oregon Department of Education, Career Technical Education specialist over there. One thing we didn't add was reference to technical assistance. It was removed from the rule language. So they said suggested language to make sure the language in the definition of training includes training and professional development. And so we kind of just reworded it to meet that. Coaching means a form of professional development. So we just wanted to make sure it was included in that umbrella. We added, changed to facilitated peer learning groups because there are so many different names for that particular activity. So we wanted to make sure we were really inclusive of all of those and didn't limit who would be eligible in that process. Next slide. We also wanted to think about expanding the definition, the types of higher education degrees that are available to receive credit for, things like early childhood mental health and some things like even business practices and fiscal for directors. So we called them early childhood education, allied higher education before we had the word related. And we heard this word allied from the group and really struck a chord with the group and wanted to adopt that language. We made sure to include anti-bias education on recommendation from the group. And just there are some other small changes in here. We added educational leadership. And then again, here was another one that was something that'll be added to implementation. Going on to the next one. I am going through these really quickly because there's a lot of them and you will have time to be able to read through all of these too. And the final rule language has been shared with you as well. So you should have that to be able to look at for your vote. In defining the registry itself, we had Oregon Registry or OCCD, and so we just changed that to also known as, so that there was not confusion that those were two different things. Making sure we're adding things again like behavioral and physical health, and things that apply to director administrative roles. On DOJ's recommendation, we added some language of as defined by the department, because we really, really want to take the time to explore this with community and make sure that we have everything exactly the way we want it to be. And so we don't want to put parameters in rules on, for example, what qualifies as mentor. We want to have conversations with the community about that further. And then there were a lot of comments about how things are going to be calculated, how points will be weighted. And again, that's going to come out in community and work group conversations. Next slide. We removed voluntary from the registry because for some people it's not voluntary because it's required by their agency to use the registry. So I just wanted to make that clarification there. In the section about tribal knowledge, we added ceremonies in the types of tribal knowledge. And then we just made up some changes to make sure that definitions matched each other throughout the document. Next slide. Explaining how documentation will be reviewed, again, is going to be part of the implementation process. We're at a meeting right now working with a work group with people from across sectors in Oregon, starting to think through that. And we will be bringing that out for public comment once we have some more established thoughts about those things. But really with an aim to just not create more barriers and hopefully reduce barriers while making the system more open and including more types of professional development. And then there was one that said, could we clarify what publicly means? Could consider putting back in the language around public-facing website, and published should also include information for employers. We didn't make a change here because we felt like the word published covered that it was available to the public, and we may have it in more places than the public-facing website, so we wanted to leave it open there. And then we made sure to add using multilingual and multimodal tools in our communication. So we make sure we can get to the broadest population possible and make sure that these changes are really clear for everyone. It is going to be a big change. So we really want to make sure to be clear about the communication and make the system as easy to navigate as we possibly can. We also included some language about making sure that if there are changes to this system in the future, that there's timely communication about those. So making sure that at least, and we will aim for more, but at least 2 weeks before any change taking place with this system, there will be broad notification to the field. Next slide. All right. We had some suggested language of we share a few comments in this section to modify language for clarity to ensure equitable access, suggestions made for readability, including portions of number 2 and separating sentences so that the comment is not super helpful on here because you don't have the numbering of the language right next to you. But we did take some direct language, I think is the point, that people in that meeting in the RAC actually suggested whole revisions of the language, and we really appreciated that support and took those suggestions and put them into the language. We changed the word evaluate to verify because really this process and OCCD's role is not necessarily to evaluate the quality of the professional development. We have other parts of the system that look at that, but really just to verify that it happened, that the person has that. And then we changed in the tribal section, engage, changed to consult for consultation. So making sure that we're clearly defining what that relationship looks like. Next one. We added evidence of and removed verified and changed approved to defined. Again, just really looking at what the role of OCCD is in this process. Again, back to what was in the definitions within the words too for congruency, we changed communities of practice to facilitated peer learning to address all the different titles that's called. And then we got some thoughts from ODE to really clarify the language around career technical education and what their definitions are. The way that it was worded, it would only be early childhood education programs, but those early childhood education related programs actually have multiple titles. And so we wanted to make sure that those were all included. Next one. All right, on to foreign language. And this is, again, the ability for a provider to have the language of a document related to the registry translated at no cost. One recommendation was ensuring translation covers training certificates and college transcripts for staff with international credentials. And we felt like the language we had really did cover that. And then the other one was suggest to say develop and implement processes in multiple language. So actual how-to will be available to everyone. And we thought that this really applied to everything, so made sure that that was in the administrative section. So, we're addressing language access in all of these pieces. Next slide. This next one, out-of-state professional development. It would be helpful to include that these processes and how to access them. Funding available to support, we will and will also be made public on the website. We made sure to include publicly available information on all of this in the administration section because we want to make sure that all of this information is publicly accessible and clear. Suggest equitable and transparent process as opposed to streamline. And so we made sure to include that one. So that was a little bit more clear what we meant by that. Next slide. This is record access. So ensuring that employers or a technical assistance specialist or someone can have access to information around professional development of employees or people they're supporting. And so instead of employer, we put authorized person because someone may want to, authorize someone to provide some language support for them or technical assistance to help them with their career planning. And so there's multiple reasons someone might want to give access to someone. We added relevant access to relevant information and the ability to upload documents on the early learning workforce members' behalf. The original rule request was access for professional development, but we have heard in the field many times that that folks want the ability to upload on their workforce members' behalf, and so we made sure to include that as well. We moved away from the language of for providing technical assistance and talked about reviewing and confirming necessary training and professional development and documentation. And because that was really what we heard was the desire and why people wanted access. And then again, that authorized person. Next one. All right. So you do have a copy of the rules. I know that career pathway section is really dense, so hopefully you've had a chance to look it over. But we're presenting to you today, and again, as Sierra said, those rules they'll actually be effective December 31st, but we'll really hit the ground running on working on the implementation in January.
Questions for Sierra or Sydney? Subin.
Oh gosh, hi, I have so many. And so I'm so sorry. And I know we're like at the finish line here. Let me start with this. This is the big question that I have. What are the actual implications for in my eyes, I feel like at OCCD, there are three big things that need some looking at, which is the core knowledge categories, the steps, and the training and education criteria. So what are the implications? Because I don't see that I don't think that's what the RAC discussed, right? And I heard you say like, oh, it will be figured out in implementation. Someone else will figure that out. Is that how help me to understand?
So the career pathway specifically, what was in here, and our aim was really to make movement on the career pathway more accessible by adding different types of professional development. I mean, we've been talking about adding coaching forever, and nationally people have been talking about adding experience. And so we just kind of broadened that and thought about all the things, the types of professional development people bring and how to include those. It is true that we have another person on the team, Andy Bales-Molnar, that is working on the training and trainer revision. That's actually a different department in OCCD too. I mean, they all work together and talk, but that's happening separately as well as the competencies. We do have a competencies section in this one, Right now, the only thing that's in that section is observation, but we don't want it to stay that way because observation is not accessible to everyone. And one of the things that we really want to make sure that we do in this implementation phase is take real life people and run them through this system, in our heads, map it out, whether or not this movement is going to be accessible to them, and making sure that we're looking at like the diverse backgrounds and languages and geography and access to different resources, and making sure that people have access to the professional development that can get them there. The scope of this work is not really at this point changing what's out there, but making sure that with what's out there, people can still move along the pathway. However, that simultaneous work is happening to look at the training and trainer piece and make changes to that so that trainings in other languages and things like that are more accessible, so that that process is easier, so that we can increase the amount of training. And then there's also a process to expand credit for coaching from just state-funded programs to everyone, and that all of those pieces will be happening in parallel. And so there's going to be overlap in these conversations, but the very specific scope of this work is defining the documentation requirements and making sure that that's not overburdensome on either OCCD side or the providers, determining, how many points for this, how many points for this, and then looking at those user profiles and seeing, what that's going to look like for a real person in the field.
So are we moving from a knowledge-based system, which is what we currently have with the core knowledge categories, into a competency-based system? Are we doing that?
So there is a transition of the language happening now to change from CKCs to competencies, and they'll be both in existence for a while because there have to be licensing language changes too, and also just to facilitate people kind of understanding that they're already doing this professional development and we're adding different language to it. And then yes, there is a goal to change to a competency-based system, but that's a long-term goal.
Okay, so that's not these rules don't solve that. Okay.
Correct.
Okay. And then my last thing was one of the things that I remember coming up in not the RAC, but I was in other conversations around OCCD, was that there are already existing bodies that handle licensure and approval in other disciplines. So for example, in K-12, they have TSPC, right? And then early childhood mental health, they have, I don't exactly know, actually, I should probably know, but they have their own system of, who approves their certificates and degrees and stuff like that. So is there, and in the past, the way OCCD has handled that is it articulates, right? So if you get a AA degree, that's an automatic step 9, a bachelor's is an automatic step 10. Was that a part of the conversation?
Yeah, they will maintain that articulation, and the things that will articulate is actually broadened. And the way that the structure of the system, the way it's structured, it leaves room for additional things to be added as they, develop in the field. We really wanted to make a system that could grow with what's happening out in the field. And so these rules are specifically described as, at a minimum, these things must be accepted, but there is a possibility for expansion.
So quick question on that then. In order for it to grow and expand, let's say there's a new degree out there, it's hot, it's cool, and we want it, right? Does it require a RAC and a new rule, or can the OCCD just decide, hey, this degree comes in?
It wouldn't require a new RAC because the language says that this is the minimum. However, we would definitely have a process in place where DELC and OCCD went out and had community feedback on that and made sure that was, and go through that implementation piece process again to do those user stories and see what that looks like and get some community feedback about, from providers about, their access and experience with it, but also from employers about will this degree, this professional development support the skills that you need in your facility. And we're also really thinking about this as not not only for classroom staff and directors, but thinking about the broader field. My position could be in here, for example. And in the definition of the workforce that you'll see in the RAC, we tried to make sure that that was really clear. And one of the next steps in this work, and again, this work is a little bit long-term too. We're going to go through many rounds of community feedback. We're going to have a pilot to kind of try it out and make sure there aren't any unintended consequences, go through all those user stories. And then a part later will really be, and we're thinking about it in this process, but really be thinking about how can someone laterally move? How can someone start in this career and then decide that they want to go this way? Like, how do those things stack together? And we're having conversations with higher education because right now we have a Step 7 articulation, but it's different in each college. So we're going to take this opportunity over the next year. We're engaging them very early. We had the Grand Articulation Summit in October and started talking about a work group to really align through high school career technical education all the way through university. And so there is a work group already that's working on that alignment between community college and career technical education. And then we're going to be starting in January another group that has university and college that's thinking about aligning what's accepted for credit for prior learning and making sure that the universities are in on that process so that then that will be accepted in the next stage as well.
Thank you.
Yeah, you bet.
Any other questions for Sierra or Sydney?
Yes,
Susan's got one more.
Was there anything discussed that may or may not make it easier for international degrees to be approved?
Yeah, we tried to include that. I mean, even though the ask was for a language translation and for out-of-state degrees, the out-of-state one specifically is out-of-state and out-of-country. So the language that's in there applies to both of those. And it's a complicated system, right? There are other states that are thinking that through as well. But we're going to take that opportunity to really think that through and make sure that it's accessible as possible. But again, we had, 9 months or so to write these rules, and we didn't want to write into rule, like this is the way it's going to be without being able to explore with the community and with the systems what that's going to look like. But this rule basically gives us commitment that we are going to work to figure that out, make sure that all of the decisions are really public and published and have those guidelines really clear policies. So we'll call you if you have thoughts about it and you can tell us.
An iterative process is what I'm hearing. So council members, any additional questions for Sierra or Sydney? If not, could I get a motion to approve this rule set? Ruby, would you take this on?
Yes, thank you. And I appreciate the process that this has gone through, and also love the opportunity for continued community engagement, not spelling everything out in the rules, and allowing for that flexibility, because I know many of the voices that were in the RAC, and I'm sure there's tons of other people that want to contribute to this building of this system out. So appreciate that. Yes, so I move to adopt the proposed permanent rule language amendments dated December 10th, 2025, that adopt amendments to Oregon administrative rules as listed on the council agenda, requests for the Early Childhood Education Workforce Registry rule set. That was a mouthful.
Is there a second?
Second.
Okay, I think Peg beat you to it, Subin. So it's been moved and seconded. Gabby, can you call the roll?
Yeah, Chair Campbell,
Yes.
Katie Brooks,
Yes.
Peter Buckley,
Yes.
Robin Hill Dunbar,
Yes.
Eric is still not here, Dr. Peg Miller,
Yes.
Subin O,
Yes.
Ruby Ramirez,
Yes.
and Marie Simons.
Yes.
Perfect. Thank you.
I just wanted to say thank you so much. And we are looking, we really appreciated the input in the RAC, and we are going to continue to look for as much input as we can. So I'm not kidding, Soup, and I'll call you. And if anybody else would like to provide input on any one of those, we're going to be working on the implementation. So let us know your thoughts.
Wonderful. Thank you for the very thoughtful and intentional approach you all are taking to this. I know it'll even allowing providers to be able to look and see whether their teachers, where they are in Oro, I think will be a welcome change. Some of those even little things make a huge difference. So thank you for doing all of this work. We really appreciate it. All right, let's move on to Birth Through 5 Literacy Program rule set, and I'll turn it over to Liz.
Thank you. Good morning, members of the council. My name's Liz Hauk. I use she, her pronouns, and I'm the early literacy policy analyst here at DELC. And I'm here to share about our public engagement and where we've gotten to with our final language for the Birth Through 5 literacy rule set. This is just a reminder that our goal for the Birth Through 5 literacy rule set was to establish a single comprehensive set of rules that'll help us clarify the purpose of the grant funds related to Birth Through 5 literacy, and will provide an outline for funding that'll help streamline guidance across programs that'll participate in those grant funds. And these are the sections included in our rule set. We have a purpose, a definition section, eligibility criteria, administration, and an evaluation section. And here's an update on our public engagement. We have here just a highlight of the really robust community engagement that went into the development of the Birth Through 5 literacy plan last year. And that included over 400 participants statewide, utilizing surveys, interviews, community conversations about early literacy needs, resources, and gaps. And that really informed the development of DELC's Birth Through 5 literacy plan, which of course also informed our rule set. In terms of drafting the rule set, we consulted with all of our teams at DELC. And then we held a Rules Advisory Committee meeting on October 9th, and I'm going to be sharing some of that feedback with you today. We also received really impactful tribal consultation in October and November. And then DELC facilitated a public comment period and a public hearing also in October. So I'll share some of the feedback from that. So now I want to highlight the Rules Advisory Committee. We received a really strong response to our call for applications to this committee, which was very exciting. We accepted 15 members that represented regions across Oregon, and that group was made up of folks that represented DELC-funded programs, organizations that deliver early literacy programming, tribal nations, and families and parents of young children. And we had 9 folks attend. You can go to the next slide, Gabby. And these are our attendees of that Rules Advisory Committee meeting on the 9th. And we're so grateful for the participation. The conversation was really dynamic. We had a lot of engagement and learned a lot from the feedback that we received. And I'll share the highlights of the feedback on the next slide. So as a part of that discussion, we had some feedback and discussion on the purpose section. Folks were highlighting an opportunity to clarify the scope and intent. And there was some discussion around how culturally specific early literacy is positioned in terms of the grant funds. We kept the purpose language as is, just because it's text that's directly from House Bill 3198. And as I mentioned before, the goal of this rule set is really to keep the rules broad enough to administer those grant funds and support the implementation of the Birth Through 5 literacy plan ongoing. We also had some great discussion and feedback around the definitions section. We heard from folks that there's an opportunity to clarify the definition of early literacy, highlighting the importance of developmentally appropriate practice and learning through play, and then really ensuring that the definition calls out that 0 to 3 age range for early literacy. So we did add that early literacy starts at birth in that definition. And then that additional feedback we've documented and will be incredibly helpful in clarifying tools for implementation, like our grant agreements and contracts, and then in resources that'll support implementation. We also received some feedback on our definition of professional development, some great discussion around clarifying what research aligned means, what research or evidence base is being referenced in that definition, what constitutes best practice. And so again, that feedback has been documented and will be really informative for clarifying those resources and tools to support program implementation in terms of grant agreements, program manuals, and program guides. And you can go to the next slide, Gabby. We had a great discussion about this eligibility criteria section. The group was just highlighting some confusion around who's included in the eligible group, a need to specify if applicants need to meet all of the listed criteria or just one of the criteria, what it means to serve children and families, if that's directly or indirectly. So we did clarify that participants in the grant funds need to meet all of the criteria listed. We clarified that in the language. And then we decided to remove the eligible entity list that we had previously included in the draft, just because it was not an exhaustive list and it really created confusion. So we thought removing it would increase the clarity of that section. And then we had a discussion in the administration section around the role of the early learning hubs. And it was a great discussion just noting that position that hubs are in terms of convening and connecting and the role that they'll play in participating in these funds. We didn't make a change to the rules, but that will be that role that they play is really detailed in their subcontracting requirements in their grant agreements. And you can go to the next slide, Gabby. So now I just want to highlight some of the takeaways from the tribal consultation that we received for the birth through 5 literacy rule set. In partnership with our Tribal Affairs Office, we were able to identify that this rule set is a significant agency action that would invite formal consultation under a new policy and process that our Tribal Affairs team has established. So we were able to invite formal consultation and received consultation from 2 tribal nations, the Burns Paiute Tribe and the Confederated Tribes of Coos, Lower Umpqua, and Siuslaw Indians. And those were incredibly impactful conversations. 2 of the key takeaways were that we heard of the importance of really documenting that tribal members that reside out of our state would be eligible to be served by Birth Through 5 funds if they're a member of a tribe located in Oregon but currently residing outside of the state. The tribes wanted to ensure that they would still be able to serve their members using these funds. So we were able to codify that in the rules. And then we also just had a really robust discussion around just additional supports that could be developed related to developing funding plans that are culturally responsive, identifying culturally relevant curriculum, training, and early literacy family engagement activities that will be culturally responsive to support the work the tribes are doing. And in response to that, our Tribal Affairs Office has already been working to develop those resources and create those connections. So that feedback was really impactful in that way. Go to the next slide. And then we did have a public comment period and received 1 written comment and 1 testimony, and that was from the same agency, and they really were emphasizing the need to clarify the eligibility section in order to avoid limiting participation and support a coordinated early literacy system. And so that work we did to clarify the eligibility section is in response to that public comment as well. And here's our short timeline of joining you all today on the 10th, and then these rules would be effective January 1 if adopted. Thank you so much for your time and happy to hear any questions.
Any questions, Subin?
This will be much quicker. So, uh, what help me to understand the implications. So at ODE, they have an approved providers list that kind of resulted as a, from the way they did their rules. Is that what Delk is planning on doing as well? I know it's kind of early to answer that, but is that the implication of the rules that we're adopting to here?
Um, I think I can answer this one, but I do have some colleagues that can jump in if I to help clarify. The purpose of the rules around clarifying how the grant funds will be administered, that eligibility section does indicate that to be eligible for the grant funds, you need to be an existing DELC grantee because those grant funds that are a part of the birth through five literacy work are really meant to enhance existing programming that we know is already supporting early literacy. So, as I mentioned, we removed the list of entities that could be eligible just because it wasn't exhaustive, as I mentioned. But those criteria around serving children and families in service of early literacy for kids ages birth through five, and then also being an existing DELC grantee just highlights the way that the grant funds will be used in terms of supporting existing programming that we know is already making an impact in early literacy in the community.
And so if it's organizations already receiving DELC funds, I'm imagining we're talking about like our CCRNRs, hubs. I know there was a note there around hubs and stuff like that. Makes sense to me. That's all sounds great. But if they wanted to subcontract, if they were like, hey, we need help on this, is that something that could happen? Or are we trying to avoid that?
That's a good question. So the subcontracting requirements are being detailed in grant agreements. I don't know if I can name off the top of my head the specifics of the subcontracting requirements, but definitely that is an option as detailed in folks' grant agreements that they'll be receiving, how they can subcontract out funds, and what the requirements would be for reporting that to DELC and for our support in managing that process. I don't know if Lauren Sigmund's on the line. I don't know if she wants to add anything there. She has kind of more of a high level view.
Good morning. Thanks, Liz. Yeah, for the record, I'm Lauren Sigmund. I'm a preschool specialist at the Department of Early Learning Care. I help support and liaise between our agency and the Department of Ed. So, Subin, I can help connect the dots for you on ODE's literacy funding and ours. So Liz is correct. And I think kind of more directly in response to your question, Subin, DELC has not established a requirement list or recommended list for who our funded grantees can partner with in delivering services. Rather, the grant agreements and the manuals outline the types of the requirements related to like what that service delivery should entail, the cultural responsiveness, the research-based alignment, and other things like that. But we would allow those grantees to work with their regional partners or local partners that best meet their needs and can deliver those services in alignment with the grant requirements.
What I worry about is that we've heard through other engagements with CCRNRs and hubs that, even when they receive funds and they put out new job positions, they keep tapping the same wells, right? They keep hiring the same people. And so I feel like we want to give our agencies options, right? Some of them will hire, some of them will get some outside help. And so I just want to make sure that they get what they need.
Marie.
Thank you. Liz, I apologize if I missed this from your presentation, or maybe it's not in your scope, but I wondered if either you or Lauren could talk about how are we evaluating the success of these funds or the appropriation of these funds? Like what is our metrics? How are we evaluating whether or not the intent of all of this work and expenditures are achieving our intended outcomes?
That's a great question. We do, of course, have like reporting metrics in place where folks who receive these grant funds will be reporting to DELC quarterly on their progress. I can also back up and say that when we were building out the Birth Through Five literacy plan, there are some stated outcomes in the plan, and then, of course, our recommended strategies to achieve those outcomes. And we did select our existing DELC programming, knowing that there was evidence-based and research around the impact that they're already having on early literacy. So kind of the funding strategy around enhancing some of these existing DELC programs with additional funds is that we knew that there was an evidence base there already for them to do this work and support early literacy. We're also in the process of building out an evaluation plan that will be sort of related to funding availability, but we want to really dig into the impact that this work specifically has on families, whether they're, feeling more equipped to support their children in early literacy, whether their behavior is changing around reading to their children, accessing resources related to early literacy. And so that would be part of a broader kind of an evaluation plan that would come kind of in the middle of the biennium, depending on funding availability. And that impact is really the focus of that plan that we're mapping out now.
I guess in my mind, and maybe I'm thinking about this, like those are great inputs, and how people feel or behaviors that are changing. So yes, a part of it. And at the same time, I'm assuming that our funding with respect to 0 through 5 literacy is to get children reading. So how are we evaluating that in the sense that reflects the inputs that we're talking about? I don't think kindergarten assessment is happening anymore. Correct me if I'm wrong. So I guess maybe that's not it, but what are our targets that we're shooting for? And then how are we measuring whether or not we're achieving those?
Carrie, I saw you came off mute. I didn't know if you were intending to jump in.
Yeah, and I want to be clear that we don't expect reading to be the outcome in early childhood. We expect reading to be happening between, generally first and third grade is the benchmarks, right? So, but we could work as a team to get back to you about, I know that we had plans for specific evaluations dollars, but then when we didn't receive all the funding expected, then we focused on the services. But we can get back to you about additional detail that we have on an ongoing basis and how can we document the impact.
Additional feedback or questions from the council? If not, could I get a motion to adopt the rules? Robin, would you take this one?
Sure. I move to adopt the proposed permanent rule language amendments dated December 10th, 2025 that adopt amendments to the Oregon Administrative Rules as listed on the council action request for birth to 5 literacy program rule set. All of these are a mouthful.
Is there a second?
Second.
It's been moved and seconded. Gabby, can you call the roll, please?
Yes. Chair Campbell,
Yes.
Katie Brooks,
Yes.
Peter Buckley,
Yes.
Robin Hill Dunbar.
Yes.
I see Eric. I thought I saw your name, Eric Hunter.
Yes.
Dr. Peg Miller,
Yes.
Subin O,
Yes.
Ruby Ramirez,
Yes.
and Marie Simons.
Yes.
Perfect. Thank you.
The rules have been adopted. Thank you guys for your work on that. Okay, we are moving on to employment-related daycare. Before I turn it over to Jen, just wanted to note, council, in case you did not see Gabby's email or catch this in your agenda, that the rule set that is specific to the waitlist rule that we had a very lengthy discussion on has been pulled out of this rule set. So just wanted just to flag that if you missed that in the materials from Gabby. So we're going to proceed with the other rule sets related to funding levels and all those kinds of stuff, but the rule set on the waitlist specifically has been pulled out of this set. And I will turn it over to Jen.
Yes, thank you. Good morning, everyone. My name is Jennifer Eras. I'm the lead policy analyst for the Child Care Systems Program team here at DELC. So we primarily work on maintaining the employment-related daycare program, as well as a few other items that are childcare related. And I do apologize, my voice is a little bit stressed today, so we'll see if we make it through this and you can hear me okay. And just want to confirm everyone can see my screen. Perfect. All right, and so in this rule set, we had a total of 5 different rules that we brought forward. We have, obviously, this one is highlighted here that it's not going to be moving forward. I still did want to touch on some of the items related to that as well. And we also have some rules that are interconnected. So you'll see this, this rule referenced a few times. When we moved the rules over from Oregon Department of Human Services to DELC, we did consolidate all of the verification requirements into one rule. But as several of those rules were existing and kind of commingled with other safety net programs at ODHS, we've been finding verification requirements within other rules. And so we're just pulling those over as we find them. So you'll see this one mentioned a few times in the presentation. So first off, just want to hop into a little bit of the information about the RAC feedback that we received from the waitlist bypass rule. So the waitlist bypass rule, essentially, it was going to be allowing waitlist bypasses to be shut off independently from one another. Right now, the rule basically only allows for the waitlist to be implemented with all of the bypasses or not implemented at all. So that's the current language that exists in the rule. We heard feedback very clearly that that there would definitely be issues with turning off these bypasses. So to clarify, the bypasses are vulnerable populations that have been identified over the past 15 years of the employment-related daycare program waitlist being in existence. And so there were definitely concerns that this was allowing DELC to turn on and off these waitlist exemptions. There were concerns noted just due to general lack of funding. So for this biennium, we are set to be overspent for the program to the point where we have to take action on certain policy levers to try and decrease our funding, or we will run out of funding before the end of the biennium. So that's the reality of where the program is heading at this point in time. And that was heard very clearly. All of the RAC participants were very clear in stating their disappointment to the funding level that's been given to the program over the last few years. There was very specific feedback about the Baby Promise bypass and stating that if this bypass is shut off, there are Baby Promise providers that, due to the lack of reliable funding, would potentially close their doors. And then there were also questions about DELC's authority to be able to turn off bypasses independently of one another, given the current statutory language. So the current statutory language does call out a prioritization of TANF families. So as a program or as an agency, we're required to prioritize TANF families within the available funds that we have for ERDC. The other bypasses are not mentioned in statute. Those were all created and put into Oregon administrative law. They're not represented in statute. So based on the feedback, we did actually update the rule on some additional feedback regarding concerns about the notification period. So when we shut off the bypass, they wanted us to be able to give proper notification to families that could be impacted. So by shutting off of a waitlist bypass, the families that could potentially be impacted are basically all families in Oregon who have a desire or need for childcare. So it's not the individuals on the waitlist, it's the general public. So we did incorporate some of that language, but ultimately, due to some of the questions about statutory authority and this just being a step out of order, we did pull this rule from the rule bundle effective January 1st. And then we also received public comment on this rule. There were oppositions to changing it, stating that we didn't have authority provided by statute. There was very clear statement that decisions to activate and deactivate ERDC waitlist exemptions should be those decisions should be made by the legislature due to the funding impacts that they have. And then there was also information that essentially that this would give DELC authority beyond what was the intent statutorily, and also that the waitlist decisions, they carry significant consequences for Oregonians. And like I said, these are vulnerable populations. These are the families who have applied for the domestic violence assistance grant through ODHS, and there's a very time limited window for that bypass. These are families who require childcare in order to keep their child in their home through the child welfare bypass or return the child to their home. Also, that referral works to place a child with a known adult. So this is with a very heavy heart that DELC is even having to address this option as a policy lever to try and make up the difference in funding. And essentially, like I said, the action or the response that we took to this is we're pulling the rule from this bundle and it will be postponed until June 2026. So we won't be asking for a vote to adopt this rule. On with some of the other rules, these aren't quite as interesting, so I apologize for that. But 0030, this is our general financial eligibility rule. There was one reference to flex spending accounts in this rule talking about giving examples of deductions from gross income that still should be counted in a family's countable income. So for the employment related daycare program, we just use gross income. We don't deduct out shelter or utility costs or things that other programs allow for. And this has just been the way that the program has been modeled historically. And one of the things we were running across is, even though it was just an example of a flex spending account, there are multiple different medical accounts, so like medical savings accounts, health reimbursement arrangements, where individuals can select an amount of money to be withheld from their gross income and placed into the account. So it's that voluntary kind of placement of those funds into a separate account that makes it still countable in the system. So this isn't changing the way this income is counted for the program. It's really just trying to add additional examples and clarity into for 0075, we had multiple changes to this rule. So this is a rule that covers provider eligibility. It also covers payments and the rates for providers, payment limits, the allowable hours for families. So it covers multiple different things. We had one change where we went through and updated special needs language, where it was saying that when care is required above and beyond the norm, the suggestion was to change it to above and beyond what is typically expected. And so we updated that language for clarity. We're updating provider rates. So for licensed family and center-based providers, we have those rates increasing on January 1st. And then there was also some inaccurate language regarding travel time calculations. And I can get into that a little bit when we talk about feedback. But we were really just making some adjustments so that that language matched how the calculations actually work and have been working over the past 7 years. So to give a little more detail on the provider rates, this change for January 1st is one of 2 steps in what came out of provider bargaining, and also kind of a longer term goal that the state's been moving toward over the last several years. So like I mentioned, with these rates, we have licensed family and center-based providers that are increasing. The family, friend, and neighbor rates or license exempt family rates are not increasing January 1st. And I do just want to say that is, we had a request from the SEIU provider union that works with these providers to bargain. We're attempting to set up dates and we just didn't get a timely response. So the final request from SEIU was, instead of bargaining, they did want just an extension of their current contract. And they asked us to propose rates to them instead of them giving us a rate proposal. We've proposed rates and we're just waiting to hear back. But unfortunately, the timelines that we have to not only get the changes into rule and present to you, but also to get those changes into the system, those have already passed, and we still haven't heard from SEIU. So our goal is I'll probably be coming back here in February to talk about a March 1 change to increase rates for family, friend, and neighbor providers, or at least that's what we're hoping for. Some of the things in the rates that we have are the monthly rates for rate area A are increasing by 6%, where the monthly rates for rate areas B and C are increasing by 12%. And I do want to clarify in the market rate study, we have 3 distinct rate areas. We've essentially been disregarding rate area C. That's the lowest paid rate area for several years, and we rolled those providers up into rate area B. But in the rule, it's still represented as rate areas B and C, but you'll see in those charts, it's the exact same dollar amounts between the two. And then also just noting in the market rate study, there's the rate area A list of percentiles in where the rates fall, and then there's a rate area B, and those aren't equal to each other. So, you know, the 65th percentile in rate area A is different than the 60th. It's higher than the rate 65th percentile in rate area B. But just noting, there are greater increases for rate area B, though it doesn't quite narrow that gap between these two in this round of changes. So the rate areas that these were set at for rate area A, it was set at the 65th percentile. Rate areas B and C were set at the 80th percentile of rate area B, and that is still lower. There will be additional action taken on this next year. So this was a 2-year process in the negotiations. So next January, you'll see we actually get to pull rate area B over to that rate area A scale. So there's still a pretty big gap. We're still working toward closing it. But the difference in cost, this current proposal, including what we've got for the family, friend, and neighbor providers, is about $48 million for this biennium. And that's pretty big considering where we're sitting with our budget currently. If we were to pull everyone over to that rate area A at the 65th percentile right now, it would be a total of $80 million. And so we just don't have the funding to get there yet, but we're working toward it. So this will be a very big step in just getting everyone on the same scale so that it's clear on where exactly the providers are and what that gap is that we have to close. So I think that's going to be a great next step. And then, so some of the feedback that we received, and this was in public comment, this is what I was alluding to earlier regarding the corrections that we were making to the language. The current rule language said that we would allow 2 hours of travel time. It's not just travel time, it's also for unpaid breaks, but 2 hours of travel time a day. And if people needed more than that, then they could request more. The 2 hours is based off of the system calculation that gives an additional 25% of travel time, but it's also making the assumption that someone is working 4 or 5 8-hour days a week. And so that's why the language just really wasn't appropriate, because the calculation is just 25% of whatever someone's work or authorized school hours are. We tack that 25% on to cover travel time and any unpaid breaks or things along those lines. So there was a little bit of a misunderstanding when we received the public comment, thinking that we were trying to reduce hours that were being allotted to families, but really this language is just more clearly outlining exactly what the calculation is to give that travel time to families. And just to note, there are allowances within the rule currently, and they're still remaining there, where if people have travel time beyond that 25%, they can request it. So for example, we have some people who have extremely long commutes or commuting via public transportation, and it just takes longer. So that language is still there. It's still maintaining. Also, there's allowances for people who work split shifts and they can't essentially get back and forth in between those shifts. So we see that a lot with bus drivers. and different folks along those lines. So that was essentially the full summary of this feedback here. Is there was really just a concern that we were trying to reduce hours that were being given to families. But it was really just not correct language to begin with. So so we're hoping that the clarified language and that we can also provide some additional information in our public facing, like in our child care provider guide, just clarifying what that travel time looks like. And next, we had our high needs child care payments rule. So in this, we had existing language from another rule that we had moved over so that we could keep all of that information together. And we also added in a requirement where we needed to have the plan or the verification for the child to be within the last 12 months. This is something that was currently already in practice, but it just hadn't been stated in rule. We do also have allowances and flexibilities to account for any delays in those plans being updated. And then we also made sure to clarify that we needed to review the supplemental payment determination annually. So that's something that, again, the high needs assessment is done annually, but this was just some language that was missing from that initially. As far as 0025, this one I mentioned a little bit earlier as being our verification requirements rule. The changes that we made here are that we pulled over some of the special needs rate and special needs age information from those other rules into this verification rule, so we have it all in one place. We also clarified that special needs age needs to be verified at both initial application as well as reapplication or renewals that are done a year later. And then we had to add specification in that the self-attestation is only permitted for special needs age when other unique circumstances are included. And I realize that's very kind of vague, broad language. This language has been in there for quite some time. Essentially what special needs age is we continue to pay the school age rate for children up through the end of the certification period where they have turned 18. So it actually goes from 13 up to 17, but they get to finish out their certification period. And we rely on families to tell us what those other unique circumstances are. We've had things along the lines of families experiencing domestic violence, families who experience home invasions, unsafe neighborhoods. Most commonly, I think, are families who, single parent families who work a graveyard shift and they have a 14 or 15-year-old that they really don't want to be at home alone. We rely on the family's expertise of their own situation to allocate whether or not this is something that's required. So we just had to clarify that self-attestation piece is really for these circumstances, which we can't possibly even begin to imagine all the circumstances that have come up for families. So all of the examples I gave, these are families who have contacted us and have been asking for this type of assistance. I think we've even had concerns where there was a mother of a teenage daughter who had to walk by a bar on her way home from school, and the patrons of the bar were harassing her. And so we had to talk her through how she could get childcare assistance so that she can make sure that her daughter was safe. So like I said, we can't even begin to try and spell out or narrow this language down just because it is so unique based on each of the family situations. And then some of the public comment that we received from this brought to light some errors in the original language of the rule. So this was really interesting to us. There was language requiring that a child's enrolled in an IFSP or an IEP with that written plan for the last 12 months. And when we consulted with Inclusive Partners, they explained that there are other avenues that families can qualify for this, but those other avenues were kind of a missing piece in the rule language. And we've as far as our actions to respond to that, we would have loved, we actually have drafted language that we want to include those other avenues, but it was outside the scope of the changes that we had requested to change. So initially what we had shared with the RAC group was taking language, exact language from this rule over here, and we were moving it to another rule. And so we really didn't feel like we could add additional rule language at this time, but we have that ready to be incorporated also in our March 1 rule bundle. So we took the feedback that we received from the public comment and drafted some rule language and worked with inclusive partners to make sure that we weren't missing anything on that as well. There was, in addition to that, there were some current concerns about the high needs payment and how it was inconsistent with the federal special education law. And that's something that has come up in the past with the high needs and special needs rate. So essentially with the Americans with Disabilities Act, you can't charge more for childcare because a child has a disability. What our special needs rate allows is for families to have more access to more providers, and it pays a higher rate so that they can essentially have more options for childcare in their area. The high needs rate is intended to cover the costs of like additional costs incurred by the provider. So this, in some cases, it's bringing on additional staff. It could also be making additional accommodations within the childcare setting. So and that varies greatly depending on the child and the needs that they have. There were also some recommendations that were revising the language to better align with the objectives and legal requirements. And then supports, and there was support for the remainder of the, so that was also outlined in the public comment. So like I said, we've gone through, we do have some new language that has been identified, and we'll be incorporating that into the March 1st rule bundle for this. I feel like my voice is about ready to give out, so luckily we are near the end of the presentation. So we did have 9 participants of our RAC. There were folks from different types of childcare providers, Family Forward. We had the unions participating, as well as the hubs represented, and that brought in really important voice for that baby promise bypass. So they spoke very clearly to the baby promise providers that they work with and impacts that would have. It was a very engaged RAC, and they gave us fabulous feedback. And then this is the rest of our timeline. So we're right here on December 10th for the vote to adopt the rules. And if they are adopted, they'll be effective January 1st. And are there any questions?
Any questions for Jen? I just want to express appreciation to DELC for your willingness to pull back the waitlist rule. I mean, I think we heard pretty strongly from the community concerns about that. So appreciate you hearing both the public and members of the council about those concerns and being flexible. And then the other thing that I am really excited about is seeing the gap between the urban and rural providers beginning to close, and thinking about how we get to a path of more equity between those types of providers. So I wanted to acknowledge that work as well. I know that's something that several of us on the council have been harping on for a couple of years now. So it's exciting to see that moving in that direction.
Yes, and that's something we've clearly heard from the provider unions over the last several years. And we're taking steps forward as we can. I'm really excited about the January 2027 change, just to, like I said, to bring all of those providers on the same scale, so it's very clear and evident what the gap is and where the need is for change. So I'm excited about that, and just appreciate all the feedback that we received. So.
Great. Any other questions or comments before we move to a motion? If not, could I get a motion from you, Peg?
Sure. I move to adopt the proposed permanent rule language amendments dated December 10, 2025 that adopt amendments to the Oregon rules as listed on the council request for employment-related daycare rule set amendments.
Do we have a second?
I will second.
It's been moved and seconded. Gabby, can you call the roll, please?
Yes. Chair Campbell.
Yes.
Katie Brooks.
Yes.
Peter Buckley.
Yes.
Robin Hill Dunbar.
Yes.
Eric Hunter.
Yes.
Dr. Peg Miller.
Yes.
Subin O.
Yes.
Ruby Ramirez.
Yes.
And Marie Simons.
Yes.
Great. The motion passes and the rules are adopted. Thank you so much, Jen. All right, Council, we will move on. We have just a few more housekeeping items. The next one up is the Early Learning Council Charter and Approval. As you all know, we started a discussion during the retreat in October and saw an initial draft of the charter, which in large part is capturing what is already in statute, putting it on paper, but then also addressing things like the chair and vice chair and how we establish committees, those kinds of things, just putting a lot of the rules of the road in writing. So the draft that you received in this packet has been modified just slightly from the one that you saw in October. Specifically, Harriet went through, and I think in the original version, it referenced the statute, but didn't actually spell them out in the charter. And so this version that you have actually just takes all of those various statutes and verbatim puts them into, I think, section 2 of the charter, where it talks about the council's purpose. And so in the sake of time, will not go through section by section, but if you have questions or things that you wanted to flag, happy to talk through any concerns or edits that you'd like to see made.
Just a question about the tenure of committee co-chairs and whether it's retroactive, because I believe Peg and I started as co-chairs in 2022. There was no official reappointment of us in 2024, and the charter, I believe, says that we need to pass it on in 2026. That's my understanding of it, so I just want to make sure that is actually accurate.
That's a good question. I mean, I would interpret it to be starting when it's passed, but I don't, Gabby, do you have a thought on that?
I would also interpret it to be starting once it's passed, but happy to also kind of just chat about that as well, Peter, just given that you and Peg have been, co-chairs for quite some time. I know capacity changes, so happy to kind of discuss that further if we need to kind of transition and see what else we can do about that.
It's hell working with Peg, you guys. I just got to say, it wears me down.
Funny, she says the same thing about you. Any other questions or feedback on the draft?
I just want to say I appreciate Harriet including the actual statutes, but so page 3 and 4 open a lot of questions for me. And I think this is a great first step in terms of sort of thinking about what the council is actually able to do and what's under our purview. And this is more expansive than I think how we've been functioning. So I'm very curious to explore with the council, like where we want to potentially dig in a little bit more in the future. So there's a lot in here, but one of the questions that I had, and of course it's a question and I think it's fine to include it here, so I'm just throwing this out there, is number 6 on page 4 about rules from other departments and done rules that are consistent with the requirements of the statewide early learning system and with the direction of the Early Learning Council. That's totally different than what my understanding has been. So I'm curious to dig into that. But otherwise, I think this is great. It's been super helpful just reading it and like chewing on it since we met in October. So I appreciate the work that's gone into it. And I think this will help the council and our future work too. So thank you.
Yeah, I have the exact same wondering that you do, Ruby, about how this might actually look in practice. And I think Gabby has started some discussions with some of the other agencies and their rulemaking staff to explore how this might look. So I think more to come for sure as we sort of, because it's uncharted territory. I think, to my knowledge, they've never, the council has never actually done that role. And so it's, I think, an interesting opportunity to engage our agency partners in a new way. So I'm eager as well to see how that unfolds. Other questions or feedback on the charter? If not, could I get a motion to approve the charter as presented?
Certainly. I move to adopt the Early Learning Council Charter as included in the Early Learning Council packet on December 10th, 2025.
Perfect. And then I can just call the roll. Chair Campbell.
1 second. Is there a second?
I'll second it.
Oh, thank you. Thanks, Liz.
Okay, let's go ahead and call the roll.
Yeah. Chair Farrar Campbell.
Yes.
Katie Brooks.
Yes.
Peter Buckley.
Yes.
Robin Hill Dunbar.
Yes.
Eric Hunter.
Yes.
Dr. Peg Miller.
Yes.
Subin O.
Yes.
Ruby Ramirez.
Yes.
And Marie Simons.
Yes.
Great. Thank you all so much. Onward. So next up, I'm going to turn it over to Gabby just to give a high level. Gabby and Harriet and Carrie and I meet on Thursday mornings and have started to map out sort of a plan for meetings in 2026, really trying to stay focused on home visiting and childcare access in particular, but then also thinking about how to continue to support the work that's happening in Raise Up Oregon with our agency partners. And then also, because we realized this in our charter work, thinking about how we are communicating council priorities to the governor's office and the legislature moving forward. So Gabby, I will turn it over to you.
Thank you. Yeah, so council, you should have received this as this was included in your packet, but this is really just a preliminary. There might be some slight adjustments in terms of where we hear some of these, especially just with the agencies as we kind of confirm availability and do like a preliminary. Do you sense any conflicts for your director? So it might change slightly. The dates will not. These are confirmed. And these should already be on folks' calendar, but yes, just kind of highlighting where we're hoping to have some childcare focused meetings, home visiting as well, Raise Up Oregon, informal kind of just like progress reports for you all with the goal of having a more formal report out and kind of sharing out progress along with the other agencies during your council retreat in October. You'll see that the schedule is pretty aligned to what we've seen before. It's right around every fourth Wednesday, with the exception of March, just to kind of avoid spring break. Rulemaking only meeting in November, and then just kind of a recap meeting in December. But like Chair Farrar Campbell mentioned, this is pretty preliminary. We are still, kind of focusing on moving these core 5 focuses, and also just wanted to see if there's any thoughts or suggestions from folks. I know previously we have involved some of you in some of the planning. If there's any interest or any thoughts or ideas that folks would like us to keep into consideration for a 2026 council meeting, please let me or Chair Farrar Campbell know, and happy to kind of work to get something on there.
Gabby, I always think it's good if we have a meeting that focuses on the hubs at some point to stay aligned.
Robin.
I was wondering, when it says agency and it has is there a change in all of them coming to each to do their updates, or that was a little confusing for me.
Yeah. So yes, I think right now, Robin, what we're really focusing on is having one agency director join just to kind of give a focus to their agency at this point. Granted, there are going to be several kind of cross-sector areas where we'll invite several of them. One example, right, given home visiting, where we'll likely ask the 4 home visiting agencies, OHA, DELC, OHA, and ODE, just to participate as well. But in terms of the agency director hour, I believe we're trying to focus it on one agency at a time, just because I know we typically run out of time, but open to suggestions as well if folks would like to try and have some more joint time with directors. Like Chair Campbell and I mentioned, it is pretty preliminary and happy to accommodate as folks see fit.
I think that's great. I was thinking that it's helpful. It has been helpful that as we shifted to specific updates from the agencies related to the topic that we were covering, so that, for example, if it was around social emotional, which I see missing, and I don't know if you would embed every child into the child care updates, but that's like a 2-part comment question is, for example, when we had updates from each of the agencies related to that, is really powerful, I think, to connect the dots between what each agency's role is in relationship to early childhood and the topic at hand, whether it's home visiting, since so many agencies have home visiting programs. So, for example, I would be interested in the home visiting topic having ODHS and OHA, which I hear you saying there's an opportunity to include more than one agency, specifically if there's something we would ask them to present on. But that's one thing that I see potentially to ensure that we connect the dots and don't just have it be a general update from ODHS or something like that. And then the comment about every child belongs. It's such a big program for us to be paying attention to, and such focused work with the July suspension expulsion deadline coming, and it feels like something we need to really have on the radar, but maybe you already have it there and not understanding how it's laid out. Okay, that's all my comments. Thanks.
No, thanks, Robin, and appreciate that feedback. Yes, so I would say that childcare and Every Child Belongs, we're keeping it broad specifically to fit all of those other little details, which I understand now seeing that at first glance, right? It's definitely not clear. But yes, Every Child Belongs is on our radar. So I'm working with DELC staff just to kind of get in some updates for folks in this group as well. So yes, keeping it high level, but yes, all of the things that you all are noting, we're essentially kind of keeping in the back of our mind and kind of keeping like a running list of this is what council wants to hear about to incorporate it into these meetings. Yeah, Ruby.
Well, Robin covered what I was going to say, so I just wanted to second the conversation around Every Child Belongs, and past that, even just social emotional development generally. And I'm also always interested in workforce conversations. So across these topics, workforce conversations, but if there's another workforce conversation, right, like around potentially maternal health or things that have been emerged from the last legislative session, the Momnibus stuff, touching on that piece as well. I know there's a lot of conversation around doulas right now, and it's one of the things that was successfully moved forward last legislative session. And there's a lot around building with the workforce there too. So I'm interested in sort of paying attention to the entire ecosystem. I mean, I know it's a lot, but at least the sort of the workforce pieces, because I think we heard it mentioned here today too. I think it was Subin that's saying these agencies and these organizations and community-based organizations are sort of picking or using the same staff for different things with, different funding. And so how do we support that, increasing the availability of a workforce to support all of these programs? So I will stop there, but just want to highlight that as an important piece for me.
No, thank you, Ruby. Appreciate that feedback. And I know that workforce is really important for this group across the board, similar to how you mentioned it in terms of just cross-sector work. So just kind of hearing the feedback from you all really is just reaffirming how me and Liz will go about planning these and making sure that we incorporate these topics sprinkled in throughout the year.
Additional questions or feedback? All right. Anything else that anybody would like to share for the good of the order?
I just want to say I really like the pace and how we're being thoughtful and thinking through the year as we go forward. And it's so helpful for me to really get my head wrapped around where we're going to concentrate each time. So good work, Liz and Gabby. It's great.
Thank you for that feedback.
Yeah, thank you. And I will circle back with any edits or changes that come when I meet with agencies later this week. So just expect something from me, I think on Monday, just to kind of confirm the dates. And yeah, we'll start populating things into Outlook calendar so that folks can kind of see what we're going to focus on in 2026. So thank you, and really appreciate the feedback from everyone.
Great. Thank you all so much. If nobody has anything else for the good of the order, it is 10:44 and I will adjourn the meeting. See you all. Have a wonderful holiday season and see you in 2026 where we'll be gearing up for the short session.
Thank you. Happy holidays, everybody.
Bye-bye.
Happy holidays.